All right, good afternoon, everybody. Thanks so much for coming. We've got all the technical details worked out. We're going to get started. As I said before, my name is Josh Sharfstein. I'm the Associate Dean for Public Health Practice and Training. Let me say how thrilled I am to have Professor Lanphear here. Right now, Dr. Lanphear is a senior scientist at the Child and Family Research Institute at Children's Hospital and professor in the Faculty of Health Sciences at the Simon Fraser University in Vancouver, British Columbia. But I've known Bruce for well over a decade. He is one of the world's leading thinkers about low-level exposure to lead. He was the first person who said to me that it was completely wrong to think about lead poisoning as identifying properties via children who are already poisoned, and to start to think about primary prevention. He has not only published extensively in this field, he's also really, I think, probably the lead person thinking about what it means to take a public health approach to lead poisoning. So I think it's just terrific that he's able to stop by on his visit to Baltimore. You all are going to really appreciate what he has to say, and thank you so much, Bruce, for coming.
Sorry for the technical glitches. I'm going to be going through quite a bit of slides. I'll make those available to anybody that wants them. The video that I'll show you in part is readily available, so don't feel like if I go too fast you have to grab anything that you particularly want, whether it's a reference or what have you. So one of the things that I've begun to recognize over the past 10 years or so is that, probably like many of you, I started out my career with this idea that if we identified the science, if we found out what levels of lead, for example, were toxic, then we would take action. Policies would happen, people would be happy, lives would be saved. It isn't that easy. And so for the last 10 years of my career, I've started to think about why that is and to begin to focus more of my time on producing videos. And I'll give you, again, a little snippet of one. What I wanted to talk about today is crime of the century, our failure to prevent the lead pandemic. And I'll talk a little bit more about why I would suggest I nominate lead as the crime of the century when there could be so many other things. And I'm particularly delighted to be here because so much of the science, so much of the advocacy, so much of the early thinking about public health happened in Baltimore. Prevention is easy, a pediatrician said. Paint containing lead should never be employed where children, especially young children, are accustomed to play. That was over 100 years ago. And when did we ban lead-based paint in the United States? 1970s. There was a few places that banned it a bit earlier, New York City, for example. But for the most part, we failed to heed those warnings. You may control conditions within a factory, Alice Hamilton said in 1925, before the introduction of tetraethyl lead to gasoline. But how can you control the whole country? Now, she said this knowing full well you couldn't control factories. There was a plant on the DuPont campus where they made tetraethyl lead, and it was called the House of Butterflies because men would start to see things after being exposed to tetraethyl lead. Herb Needleman, who I'll talk a little bit later, worked at the House of Butterflies during one of his college breaks. So despite those early warnings, we continued to use lead over the past century. Tens of thousands of pounds in white lead paint. And then, even though it declined during the war years, it was needed for the war effort, it became more widely environmentally dispersed through gasoline. And this is really the first crime. Widespread dissemination of a poison when it was wholly preventable. And the reasons for this are pretty obvious. If you go back and look at the very concerted effort of the lead industry to make it appear that lead was safe, knowing full well that it wasn't. And some families and some companies that you might be familiar with, from DuPont to Sherwin-Williams, General Motors, families like the Rockefellers, the Guggenheims, made immense profit on the monopoly of lead. That's the second crime, immense wealth at the expense of public health. There were some early successes in the battle against lead poisoning. Following the gradual phase out of lead from gasoline in the 1970s into the 80s, there was a drop in blood lead levels much greater than anticipated. In fact, in the 70s, if you go back, the Environmental Protection Agency argued that it was a housing problem, not an environmental problem. And the U.S. Department of Housing and Urban Development said, it's an environmental problem. It's not a housing problem. The EPA refused to take it on as a criteria pollutant until they were sued by the National Resources Defense Council. Here, though, you can begin to see dramatic declines, suggesting that lead was at least one of the major sources. Now, this victory is a bit marred by the fact that it wasn't taken out of gasoline to protect children or to protect adults from hypertension. It was done to protect the catalytic converter. One of the early studies by Ellen Silbergeld raised questions even back in 1974. I'm sure she did this when she was about 16 years old, right? 1974, where she was studying palsy from lead exposure at the time, workers' palsy, and came across this phenomenon where when she administered it to rodents, they were much more hyperactive, about 3 times more hyperactive in the lead-exposed group compared to the control group. And I was talking with Ellen about this last year in Italy, and I said, well, how did you come on this idea to test methylphenidate and other drugs that were used to control ADHD? And her sister was working with developmentally challenged children. And so she took it to the next step and showed you can control hyperactivity with the same type of drugs that we use today for children. So this is in 1974. About 5 years later, the seminal study in lead exposure was published by Herb Needleman. And I don't know how many of you saw John Oliver a few weeks ago. Did everybody see that? So Herb recruited over 2,000 school-aged children in Massachusetts. And he paid to have substitute teachers sit in. And then the homeroom teachers rated these children on a whole series of behaviors. And then he collected baby teeth from all of these children. And he measured the amount of lead. So baby teeth are really pretty cool. They're a good cumulative indicator of lifetime exposure for young children because lead, which is a divalent cation, mimics calcium. It gets absorbed in using some of the same mechanisms, and most of our lead in our body is stored in our bones or in our bony tissue, like teeth. So it was a really good indicator. And what he saw, as the tooth lead levels increased in these children, the teachers reported them as more distractible, not being able to persist in their work, not organized, more hyperactive, more impulsive and frustrated. Many of the behaviors we sort of link with ADHD type behaviors today. On the heels of that study, there were a number of other studies, both cross-sectional and prospective, and they found impacts anywhere from about a 1 IQ point decrement associated with an increase in 10 microgram per deciliter to 20 microgram per deciliter, all the way up to almost a 6 IQ point decrement for that same range of exposure. Now, some commentators looked at this and said, these estimates are so wide, they can't be real, they can't be right. Still, in 1991, one study found that there were effects below 10 microgram per deciliter. This was the Boston study by Herb Needleman and Dave Bellinger and others. One study. And that was sufficient to lower the level of concern from 25 microgram per deciliter to 10 microgram per deciliter. Now I'm going to flip back and forth a little bit in the presentation, in the video, with parts per billion and microgram per deciliter. And the reason I want to do it is because what I find is that it's much easier for the public to understand parts per billion. So parts per billion, 2 tablespoons of sugar in an Olympic-sized swimming pool is 1 part per billion. So 5 microgram per deciliter is equal to 50 parts per billion. Just add a 0. 10 microgram per deciliter, 100 parts per billion. So they lowered it to 10 microgram per deciliter, or 100 parts per billion in 1991. For his pioneering research, Needleman was accused of scientific fraud by 2 industry-funded psychologists. The University of Pittsburgh, where he was at the time, basically said, "You're on your own." They backed off. He had to hire his own lawyer. They were slated to have closed-door hearings, and he had to fight to have open-door hearings. It took him 5 years to clear his name. At this time, he couldn't get any NIH funding. It was really quite traumatic. There are things that continue to happen like this, not quite as obvious as that. So around that same time, just as I was starting my career in Rochester, this study was published. And I had just been funded to study what levels of lead in house dust are dangerous for children. Because what happened in 1990 really kind of shook up the George H.W. Bush administration. I mean, there were millions of children being lead poisoned by this time, but that didn't quite make it to the White House. But something did happen in the White House. Does anybody remember what happened in 1990? Millie the dog was lead poisoned during White House renovations. And he was quite shocked about that. And Louis Stokes, there's some really fascinating congressional testimony. Our hearts go out to Millie the dog. But does the president know there's millions of children being lead poisoned? Well, I think I might have my first grant was due to Millie the dog. Because that led to the CDC report in 1991 and the Lead-Based Paint Hazard Reduction Act in 1992, which mandated EPA to come up with a dust lead standard. That was my first study. But then this was published. And you can see blood lead levels are really plummeting, which on one hand is great, right? But my advisor said, look, you got to get out of this line of work. The problem seems to be going away. And besides, there's not going to be any funding for the research. And they were right, at least on one count. There hasn't been a whole lot of funding. We often think of it as a problem of the past, even today to some extent, even after Flint. But I was in Rochester, and while blood lead levels had plummeted around the country at a national level, you still could see in Baltimore, in Rochester, in Providence, in Chicago, very high blood lead levels. If you look at the dark red color, 1 in 2 children in those neighborhoods had blood lead levels in excess of 10. 1 in 2 children, 1 in 3 across the entire city. So nationally, it was only 1 in 20, but in places like Rochester, it was still 1 in 3. So it didn't seem like we could declare victory just yet. The other question that came up is, well, could there be effects below 10 microgram per deciliter or 100 parts per billion? I'm going to keep going back and forth on that. And what we found with NHANES, which was readily available, is that not only did we see no evidence of a threshold, but there was this steeper decrement for a given exposure at the lowest levels. Now that seems totally counterintuitive. Most of us are taught to kind of think linearly. I think we're getting better at it. Actually, most of us are taught to think that there's a threshold. So there was no apparent threshold, and for a given increase in blood lead levels, the decrements in IQ appeared to be steeper at the lowest levels. But this was limited by its cross-sectional design and the fact that we couldn't adjust for things like maternal IQ. But it was enough to get me and several other people disinvited from the CDC-led advisory committee. So under President Clinton, myself and 4 other colleagues were nominated to serve on the committee. And we came up with 2 things we needed to talk about: shifting to primary prevention and looking at the impacts below 10 microgram per deciliter. Now, if you remember, back during George W. Bush's first administration, there was a long delay in appointments and long delays in dealing with advisory committees. So it took about 1.5 years, and finally the CDC said to us, look, this has always been a rubber stamp. Why don't you just come down and start meeting? So we did. We had 1 meeting, and we talked about these 2 priority areas. And then 4 months later, we had another meeting. And there was a participant observer named Jeffrey Miller, who was from the Lead Industry Association. And within 2 weeks, I got a call and said, something's happening. We're not sure what. But what happened, which was picked up on This American Life, was the lead industry went to Tommy Thompson and said, we have our own appointments we'd like you to make. And so 3 out of the 4 of us were disinvited from the committee, and the others from the lead industry that were nominated were approved. Our next study, which was published just about the same time, and it was part of the reason that I was disinvited from that committee, replicated this, but this one was a much stronger study. It was a prospective study. We had measures of maternal IQ and birth weight and tobacco exposure and iron measures, so it was really much more robust. And what we found was the first 10 microgram per deciliter increase in blood lead was associated with about a 7 IQ point decrement. The second 10 microgram per deciliter increase, about 2 to 2.5 IQ point decrement, and the third about 1. So this really began to raise questions. And again, we saw this steeper drop at the lowest levels. Still, at that time, in 2005, the CDC came out with these, I like to think of them as excuses, but they called them reasons. Why not change the blood lead level of concern at this time? there are no effective clinical interventions, they initially said, and they added public health thereafter, to lower blood lead levels for children with levels less than 10 microgram per deciliter, which is just wrong. It's silly, stupid, wrong. Children can't be classified as having blood lead levels less than or greater than 10 microgram per deciliter because of the inaccuracy inherent in laboratory testing. Now, at this time, we were getting blood leads measured around 1 microgram per deciliter with very tight precision. Now, it was research quality, but the technology exists. At the same time, of course, we're putting billions of dollars into new genetic machinery, new genetic technology, but we can't afford ICP-MS. We can't afford to measure blood lead levels using state-of-the-art equipment. And then finally, this one made me first laugh and cry at the same, then cry. There's no evidence of a threshold, thus lowering the level of concern would be arbitrary and provide uncertain benefits. Now, the same could be true of cholesterol, couldn't it? Except there's a big difference with cholesterol. There's a lot of money to be made with drugs that lower cholesterol. The problem, I think, with lead and other toxic chemicals that we're all routinely exposed to, pregnant women, children, all of us, is that people haven't quite figured out how to privatize the benefits yet. I think that's something we really got to struggle with as a country. And then a low point. Our two leaders at the time, Mary Jean Brown and George Rhodes, basically adopted the argument of industry. New studies using designs that exclude or control potential confounding by pica, mouthing behaviors, which can indicate an underlying developmental delay. That is, stupid children put a lot of stuff in their mouth. I'm saying it a little bit more crass. They said it very nicely here. Or by environmental hygiene. Mothers don't do a good job cleaning their homes. Indicating more widespread lead contamination would be especially helpful in assessing these low-level effects. And they singled out the study that we published in 2003 in the New England Journal, but by this time there are already 10 other studies that confirm this. And if you remember, go back to 1991. How many studies that were required to lower it from 25 to 10? Anybody remember? We already had by this time 10 studies. Several of them found that same superlinear relationship, steep decrements at the lowest levels. And yet somehow, using very sophisticated language, we're still blaming mothers. We're still blaming children. All right, now let's see if I can pull this off. I'm a Mac user, sorry. Here we go. All right, so beginning about 10 years ago, when I thought the science of lead toxicity was mature enough, we knew what to do, I started to shift more and more of my time to advocacy. And I don't know if that's considered a bad term in scientific circles, but I consider myself a scientist advocate. And I see it as no different than being trained as a physician and advocating on behalf of my patients, and being a public health physician and advocating on behalf of populations. I started to begin to make these videos because what I realized is that talking to Congress isn't enough. Talking to policymakers isn't enough. It's important, but it's not sufficient. Just to give you a very quick example, I was in Broken Hill, Australia last year. And Broken Hill, about 1 in 5 children are lead poisoned. They live around this old it's a lead mine, but it was basically this mountain in the middle of their town, way out in the outback, surrounded by wallabies and kangaroos. And lead was just sort of outcropping out of this hill. And I went and talked to them about lead poisoning. And there was an older woman, a grandmother type, who got up after I talked, and she had a pile of papers like this. I mean, she's been studying lead for years. And she started to talk. And she said, I'm pissed off. I'm pissed off at the industry for poisoning our kids. I'm pissed off at the government for not protecting them. And she continued on and on. As you can imagine, there was a lot of pent-up emotion. And I finally was able to get the mic back from her. And she's, you could sort of see people edging away from her. They knew her. And I wanted to make sure that they didn't marginalize her, because what I said, and I meant it, was that if you look at where we've made progress in public health, it takes good science, and it takes moms getting pissed off. And that got picked up on the cover page of the daily paper the next day. So what I started to realize is we need to reach out and help the public understand. And this is really challenging, to be both accurate, or as accurate as possible, and help people understand. So that's one of the reasons I started shifting to think about parts per billion. When we think about parts per billion, I can compare pesticide exposures and lead and flame retardants. But in our studies, for lead, we talk about microgram per deciliter. And for organophosphate pesticides, it's micromole per liter. And for PBDEs, it's nanogram per ml. So it makes it very difficult to communicate. So this is a video we made. Actually, it's just a snippet of one. And let's see if everything works.
In the 1960s, hundreds of children died from severe lead poisoning every summer. Since then, much lower levels of exposure have been shown to result in learning deficits and brain disorders like ADHD. In fact, the World Health Organization and other agencies agree there is no safe level of lead exposure. As the level of lead in children's blood increases from 0 to 100 parts per billion, IQ scores drop by about 6 points. In contrast, an increase from 100 to 200 parts per billion results in an IQ drop of 2 more points. An increase from 200 to 300 parts per billion results in an IQ drop of another point. The impact of toxins on the developing brain is permanent. Children who are more heavily exposed to toxins won't reach the same peak cognitive ability as those who have lower exposures. These studies show that there is no safe level of exposure. They also indicate that the way we regulate toxins, which assumes there is a safe level, fails to protect children. The chemical industry argues that the effect of toxins on children is subtle and of little consequence. But that's misleading. Little shifts in children's IQ scores have a big impact on the number of children who are challenged or gifted. Let's go back to our original sample of 100 children and look at a typical distribution of IQ scores. Most of us have IQ scores that fall between 85 and 115 points. Only 2.5% of children have an IQ above 130, which is considered gifted. There are about 6 million children in this group. On the other end of the distribution, another 2.5% of children have an IQ below 70, which is considered challenged. The impact of exposure to a toxin like lead causes a 5-point drop in IQ. This shift results in a 57% increase in the number of children that are challenged, from 6 million to 9.4 million. There is a corresponding decrease in the number of children that are gifted, from 6 million to 2.4 million. Little shifts matter.
So that's a part of a video that tries to get across not just lead, but other toxins or toxicants. And we start out by talking about what are the exposures? What percent of children in the United States are exposed to mercury and PBDEs, flame retardants, and so on. And those cognitive impacts start out early in life and then can persist. So if you look at this life course, what you can see is that those children who have higher lead exposure, and we're not saying exposed and not exposed, because we're all exposed, but those with higher exposure to lead never meet the same peak cognitive ability as those who have lower exposure. And on the other end of the curve, there's 2 studies, one from Hopkins and the other from Harvard, that show that among adults, either based on bone lead or blood lead, that those adults with higher lead exposure have accelerated cognitive decline. So it kind of gets you at both ends. There's also some evidence, still pretty early, but some good evidence that lead exposure is a risk factor for Alzheimer's. Again, largely unrecognized by most, but there are a host of other factors, diseases that are being linked with lead on a regular basis. So what these studies begin to show is that there is no acceptable level, no safe level. And yet, with the exception of carcinogens, that's how we regulate toxic chemicals and pollutants. It assumes there's a threshold or a safe level. Now, in some cases, like with benzene and leukemia, with PM 2.5 and premature death from heart disease, with tobacco smoke and birth weight and prematurity, it appears that there may be a similar kind of superlinear relationship, that is, proportionately speaking, greater impacts at the lowest levels of exposure. It's a little bit hard to believe, but there's some data that came out after the ban on smoking in public places. It's quite compelling. In Scotland, for example, following the ban on smoking in public places, there was a 15% decline in preterm birth among non-smoking women. 15%. There was a 25% decline in very low birth weight among non-smoking women. That's better than any drug. And yet still, the vast majority of our health dollars are spent where? Treatment. 96% goes towards treatment, medical care, 4% left over for population health and prevention. There's something wrong with this picture. Yet it shouldn't surprise us, even though we think that today you and I and our children are exposed to low levels of lead. What this series of cartoons shows is here, each of those dots represents 40 micrograms of lead as a body burden, 40 micrograms of lead basically in bone. That represents a lead-poisoned child. Here, this is a typical person circa 1960, and this represents that one dot right in the center, a pre-industrial child. So our blood lead levels today, our children's blood lead levels today, are still 10 to 100 times more higher than our pre-industrial ancestors. So on an evolutionary scale, they're not low. So finally, in 2012, the CDC said, the evidence supporting this conclusion, some of which is cited in this document, demonstrates that no safe childhood blood lead threshold can be identified. Now, in the same document, they said, well, we really aren't willing to spend money to fix the problem like we should. They didn't quite say it that way. But we aren't willing to spend the money. We don't have resources, was what they said. So we're going to focus on children who have a blood lead level above 5 microgram per deciliter as our action level. So how many of you are familiar with the prevention paradox? This is from Jeffrey Rose's book. One person? 2, 3? A couple. Okay. So the prevention paradox, I think, is really a cool concept, but not enough of us know about it. And generally, I think it's true, it's universal, unless there's a threshold, or unless we define everybody as high risk. So the prevention paradox, which is counterintuitive, says the majority of disease and disability occurs in people who are at low to moderate risk. Doesn't that seem a little counterintuitive? Let's use lead as an example. So here, what the CDC said is that we're going to focus on those children who have a blood lead level in excess of 5 microgram per deciliter. That represents the top 2.5% of children. And it makes some sense to focus on those because taking other factors into account, on average, those children experience about a 6 IQ point decrement from lead exposure. That's a big deal, right? If we look at the next group down, who have blood lead levels between 2.1 and 5 microgram per deciliter, that represents about 6 million children, but on average, they only lose about 1.5 IQ points, right? So this would seem to be efficient to target this group. But if we only focus on those 500,000 children who each lose 6 IQ points, that's only 3 million out of the 23 million IQ points lost. So whether you're talking about new cases of diabetes, whether you're talking about lead, this concept is important and true. Again, unless there's a threshold or unless we define everybody as high risk. And we kind of know that. You remember the work on older women are much more likely to have children with Down syndrome. But if we only screen them, we're going to vastly underappreciate the women who have children with Down syndrome because most of them are younger than 35. It's the same idea. It's a real simple concept. The other problem with this, as long as we continue to focus on this group, we're going to constantly replenish that group because we're not getting rid of the sources or the risk factors. Or in other words, unless we understand this, we will inevitably fail to prevent disease. Well, it's not just IQ. This study, which involved over 34,000 pregnancies, showed that there was a decrement in birth weight of about 60 grams associated with an increase from blood leads less than 1 to 5. Now that seems quite subtle, doesn't it? 60 grams. Well, babies are 3,500 grams. Who cares about 60 grams? Well, the problem is that women aren't exposed to one stressor at a time. In a study of about 10,000 pregnant women in London, they found that women who had a blood lead greater than 5 microgram per deciliter were almost 2 times more likely to give birth preterm. And the same concept holds here, is that while lead exposure by itself may not explain, well, clearly does not explain preterm birth, this idea that there's 1 or 2 major risk factors is probably wrong. It's really probably more like death by 1,000 cuts. And so what we need to do is identify those 5 or 10 or 20 risk factors, each of which may only reduce the duration of pregnancy by half a week, but cumulatively help to create preterm births. Does that make sense? Low-level lead toxicity and psychopathology are severe behavior problems. So this was a study that we did in Cincinnati. We had a group of kids, largely poor and African-American children, followed through 23 years of age on average. And what we found is that as the mean childhood blood lead levels increased, we saw stunting or reduced volume of gray matter in the prefrontal cortex. Now that's particularly important because that's where we think of problems like ADHD and criminal behavior arising, impulsivity. This is also the part of the brain that makes us most distinctly human. That separates us from other animals. And if your prefrontal cortex is not wired right, you're not going to be able to succeed as easily as others. For example, if you look at children who have ADHD compared to controls, there's a number of areas of the brain, but particularly the prefrontal cortex, that's smaller in the children who have ADHD. Now, if it's true that this is one mechanism, I say one mechanism because lead and most other toxic chemicals like mercury and PCBs are not focused on one mechanism. They seem to be systemic toxins, or toxicants if you prefer. If this was one possible mechanism that we think might help to explain why some children have higher rates of ADHD or ADHD-type behaviors, or higher rates of antisocial behaviors, or delinquency or criminal behaviors, what do you think we'd find if we stratified those young adults by sex? Would we see greater damage in the males than the females, or greater damage in the females than the males? Or to put it differently, do males or females have higher rates of ADHD? Who would say males? Well, you'd be right. So let's look, and there you go. That's what we saw, greater damage in the males. Now, my wife's a developmental pediatrician, and I was quite excited when we found this about a decade ago. And she sort of looks at this, and she looks at me, and she says, yeah, you know what? That explains a lot. And she was looking at me a little too intently. Because you can imagine, we have all been exposed to lead. And one of the things that I think is really intriguing is if you think about all the research on psychology and differences by gender over the past 3 to 4 decades, is that normal? Or is it just typical for lead-exposed populations? What we found in a national survey was that about 18% of ADHD could be attributed to lead exposure. We also found evidence, and we've got another video about this to try to get across the idea of a synergistic or joint effects. Children who had, in the top tercile of blood lead levels, were about 2 to 2.5 times more likely to meet criteria for ADHD. Children who were prenatally exposed to tobacco, that is, their mothers smoked cigarettes, were about 2 to 2.5 times more likely to meet criteria for ADHD. Children with both exposures, over 8 times. So it was multiplicative. And collectively, that explained 1 in 3 cases of ADHD in the United States. Now think for a moment, if I designed a drug or a vaccine that could prevent 1 out of 3 cases of ADHD, I'd be wealthy right now. I'm sure I'd have endowed shares being thrown at me. We got a little scholarly attention, but not much more. And I'd like to think about why that might be. I think that offers some clues as to why we aren't willing or able as a society to act on some of this public health science, this type of public health science. Of course, there's many others. So when this concept came out that perhaps lead was associated with criminal behavior, there's been actually a long trajectory. Back in 1943, there was some evidence from Boston that children who were lead poisoned, 19 out of 20 failed to finish high school. 1 attacked their teacher with scissors. So there was some early evidence. There was a study of the Collaborative Perinatal Project in Philadelphia where they found a history of lead poisoning was the strongest risk factor for criminal behavior in young men. But still, it seemed quite a stretch to me that lead would be associated with criminal behavior. That was in the year 2000. By now, I'm quite convinced. And here's one of the studies that was done in New Zealand, again using tooth lead levels. And what Ferguson and others did is they adjusted for a whole variety of things that are known to lead to increases in
antisocial behavior, from maltreatment in childhood to maternal smoking, criminal offense in the parents, sort of that bad seed theory that's stuck around for way too long. And even after accounting for all those, they saw that self-reported offenses increased quite substantially, as did official police arrests or convictions. We saw the same pattern. Yes?
Just to confirm, so that's the equivalent of 10 per 100 or 1 micro?
Oh, so you can't really convert the teeth to blood leads very easily. A study that we did, John Wright published in PLOS Medicine, we did use blood lead levels so you can get a better sense, probably roughly comparable types of blood lead levels, but you can't convert. And that's one of the reasons we don't like to rely on teeth, even though they're quite powerful because they're a cumulative indicator, but it's hard to relate it back to the populations because this is easy to draw blood, not easy to pluck teeth. In the Cincinnati study, again, which we found very similar patterns, there was something else I think that made it quite compelling. Now this same pattern has been seen in white youth and African American youth. But in our Cincinnati study, which was largely poor, largely African American, we saw the same pattern. It doesn't appear to be a race thing, right? In our study in Cincinnati, it isn't confounded by race because virtually all of our kids were African American. But we do know that on average, African Americans have higher blood lead levels. And so it seems to me yet another crime is that we failed to protect children, the populations, from lead exposure, and somehow then victimized those populations of lead-exposed children who were at increased risk for incarceration. We've also seen, even at low levels of lead exposure in 8 to 15-year-old children using NHANES, as blood lead levels increased from the first to the fourth quartile, we saw about 7 to 12-fold increases in children meeting criteria for conduct disorder. That's pulling hair, lighting fires, torturing animals, bullying other kids. Now that's about 2% of kids. So even at low levels, there's some evidence. Now there's also some toxicologic data, and I'm not a toxicologist, so I like to kind of keep this simple. But for example, there are golden hamster models where if you expose the golden hamsters to lead, the lead-exposed hamsters are much more likely to attack without provocation other hamsters. So we can see this in non-human primates and other species. And so that gives us some confidence that we're not missing some confounding factor. We can also look over the past century and see this pattern. If you look at lead that was introduced into the environment in paint and gasoline, and then you lag that lead exposure by 21 years, because it's the toddlers whose brains are developing, who are being exposed, and it's the 15 to 25-year-olds who are involved in violent behaviors, right? So lag it by 21 years, and you see this striking correlation. Jessica Reese, who's another economist, this was Rick Nevin's work from the year 2000, tried to, well, let me ask a question before I say this. How many of you would say violent crimes have gone up in the past 2 to 3 decades, gone down, or stayed the same? So how many would say violent crimes have gone up in the past 2 to 3 decades? Couple. Stayed the same. Gone down. Good. All right. They've gone down dramatically, and for reasons that are largely uncertain. They went down in some cities, like New York City, even quicker than in other places. We already talked about that. They banned lead-based paint in 1960. Rudy Giuliani took all the credit for it. So what Jessica Reese found is that over 50% of the decline in violent crimes could be attributed to the decline in blood lead levels. Less than 30% to all other factors she studied, like how many police are on the police force. Now that's pretty striking. Even if it's only half right, that's really striking. Because what it says is widespread exposure to a potent neurotoxin like lead, but we have others, we're exposed to many others, can lead to tremendous shifts in social dysfunction. And it seems to me yet another crime is we failed to learn from the lead pandemic that widespread exposure to chemicals can really be toxic and could lead to tremendous shifts in disease and disability. This is a study, again, that came out of Hopkins. And what it found is that even at the lowest measurable levels, there appears to be increases in
mortality from heart disease. Now this too is quite striking, but it really gets very little attention. Most of our attention is focused on antihypertensive therapy. And that can be quite efficacious. I mean, we shouldn't end that. That's a great short-term solution. But why should we stop there? We talk about hypertension as one of the leading causes of death. Well, what causes hypertension? Why aren't we focused on that? In 2012, the National Toxicology Program came out, and this was really powerful because this was one of the first examples outside of tobacco where an independent scientific advisory panel was put together, and we were asked, what can we conclude from all these studies? Now, it seems pretty simple, but up until this point, I'd get up and I'd give you my opinion, and that's all it was, one person's opinion. What they said here was that there's sufficient evidence to conclude that at blood lead levels less than 5, not 5 and greater, but less than 5 microgram per deciliter, there's sufficient evidence to conclude that blood lead reduces academic achievement, reduces IQ, and increases the incidence of attention-related behavior problems like ADHD and problem behaviors like conduct disorder. There's sufficient evidence at 10 microgram per deciliter to say lead delays puberty, reduces prenatal growth, decreased IQ, and decreased hearing. And among adults, less than 5 microgram per deciliter, decreased glomerular filtration rate, maternal blood lead associated with reduced fetal growth. And finally, also hypertension at blood leads less than 10, but not less than 5. So what all of this says is that lead is, at the root, one of the major causes or risk factors for many of the common problems in society. And yet, we still focus too little time on it, even though Flint has brought it to our attention. All right, cost benefit of reducing childhood lead exposure. This is usually one of the last excuses for why we don't do anything, right? It's just not cost beneficial, so let the kids be exposed. But what if it's cost beneficial? For every dollar, Elise Gould found, we invest to protect kids from lead poisoning in housing, as a society, we'd benefit somewhere between a low of $17 and a high of $220. How many people would be willing to put their retirement investment in that? Not bad, right? Does anybody know what the cost-benefit ratio for childhood vaccines is in a country like the United States? For every dollar we invest, the benefit is? Somebody can guess. $2? 16.5. Now that's, to be fair, doesn't include HPV vaccine. That really we haven't had enough time to let that bear out. But I don't know how many of you know this. I was floored when I saw this in the New York Times. A childhood series of vaccines now cost $1,500. $1,500. I mean, it's probably what, like 32 when we got vaccinated. And there's a few improvements, but not like $1,500. Despite that, we still seem to be unwilling to make the kind of investments necessary to protect kids. The problem is so well defined, René Dubois said in 1967, so neatly packaged with both causes and cures known that if we don't end this social crime, our society deserves all the disasters that have been forecast for it. So I'd like to nominate lead as the crime of the century, and I really would have liked to play Supertramp, but it's still challenging technologically speaking. I'd like to nominate lead as a crime of the century, first because it was wholly preventable. That wasn't really true for tobacco. It wasn't until the 30s at best, and maybe even the 50s, where we recognized what a catastrophe the tobacco epidemic had become. But we knew lead was toxic before it was widely introduced into the environment. It isn't only the crime of the century because there was immense wealth made at the expense of public health, or that it seems to be one of the major risk factors for incarceration in the past half century. It seems also to be the crime of the century because, at least when we start to think about the outcomes, nobody really knows about it, or at least we don't act like it is causing the kinds of disease and disability it is. And the greatest crime isn't necessarily where you get away with the most money, or you kill the most people, but you kill a lot of people, or you get a lot of money and nobody knows about it. That's the greatest crime. And that's largely what the paint and pigment industry and the petroleum industry has gotten away with. There's only one case outside of individual settlements, which you know, that's one of the big social issues right now in Baltimore, where the lead industry has been held liable and it's under appeal. There's a public nuisance case in California, 10 jurisdictions, and they were awarded $1.15 billion. Now, the cool thing about this type of case, it's a public nuisance case. The money has to go to fix the problem. It has to be used to identify houses and other sources of lead before a child is poisoned. And still, the vast majority of jurisdictions in the United States today, we continue to use children as biological indicators of substandard housing or lead-contaminated water. Thank you. So we got about 10 minutes. So we've got just about 10 minutes if there's questions or comments or critiques. I like critiques too. It makes it a little more interesting. Yes, and please speak up, because I must have had some lead exposure and I can't hear very well.
So it's also related to hearing loss?
Yes.
I'm curious about, in the Flint, Michigan case, what really struck me was that we probably have a cohort of kids who have now been exposed to water through, in their formula. So like during that time period, and I'm curious, I haven't seen that really commented on what might be the impact. I would imagine devastating impact. And if there are other, I guess, historical cohorts that could help understand what might be the significance of particularly that very early, there was probably, of course, prenatal exposure, and then in the formula, and of course the children weren't tested until probably 12 months.
Yeah. So a couple of thoughts. The studies aren't definitive, but the window of greatest vulnerability appears to be postnatal, maybe closer to 2 to 5 or 6 years of age, not prenatal, and not necessarily early childhood. It's a little bit hard to get at that, as you can imagine, because blood lead levels tend to track. Children who live in lead-contaminated homes or drinking lead-contaminated water tend to live in those homes or those types of homes throughout childhood. But there's a great story. Rick Horning, who's this phenomenal statistician I keep working with, he came up to me one time when we had the Children's Center in Cincinnati. He says, we've got a meeting in Hawaii. Would you pay me to go? I said, well, if you send it in abstract, sure. He says, well, what should I do? I said, well, people have been trying to figure out what's the age of greatest vulnerability for 20, 30 years. Why don't you figure that out? And we had these brain scans, and what you can see is at each successive year, 1, 2, 3, 4, 5, when we look at the blood lead levels, each successive year out to 5 and 6 years. 5 and 6 is when we saw the greatest damage, not at 1, based on 1-year blood leads, not on 2-year blood leads, not on 3-year, but at 5 and 6. So I think probably for lead, which contrasts with other toxicants like mercury and PCBs and flame retardants, which seems to be prenatal exposure, lead seems to be more of a postnatal effect. Now there are a number of children, and you can see studies out of Boston and elsewhere, where they found that children who were exposed to lead from water, particularly with formula, has been going on for quite some time. But Flint was sort of unusual because some of the housing exposures had come down, and then they had this incident where it clearly was at least 50% of their lead exposure appeared to be from lead and water. So I don't necessarily think that those children would be affected differently. Wherever we've looked, whether it's from mining communities or from paint, the overall effects generally seem to be consistent around the world. And in another sense, if you look at where Flint children are, they're somewhere in the middle of the pack in terms of the prevalence of lead poisoning. My guess is Baltimore probably is higher. What percent of children in Baltimore have blood leads above 5?
It's very low. I mean, in numbers, we have about 500 children.
Okay.
And then maybe 100 or so above 10.
All right. So I don't know what the prevalence would be. The prevalence in Flint.
That's not the data at all. Yeah, it was 17. It's 2004 children with levels above 5 last year in Baltimore City.
Do you know what percent of kids that would be roughly?
That was it's like 2.4. It's in the Maryland Childhood Blood
2.4%?
It's the Maryland Childhood Blood Registry published. Yeah.
2.4%. So, okay. All right, so 2.4%, that is a little lower than Flint. Flint bumped up during the exposure, the peak exposure, to about 5. And in some parts of the community up to 10. But of course, you'll see geographic variation within Baltimore as well. So I don't think it's something, now what has been important about Flint is that it was a rapidly evolving disaster. You had all the elements right there, you couldn't miss it. Bad leadership, negligence in the environmental agency, failure to listen to the community, right? Everything was right there, you couldn't miss it. But if you step back and you look at the lead pandemic of the past century, it has all the same elements. Putting profit over people's health, for example. And that's basically what they did in Flint. We're going to save $100 a day and not use these anti-corrosive chemicals. And the result? But it's the same. So the challenge of looking at this lead pandemic is that it's a slowly evolving disaster. And we don't seem to be able to deal with slowly evolving disasters as readily. For example, we may have lost the opportunity and funding to put together a national committee to develop a 2 to 3 decade strategy to prevent lead poisoning because it might be shunted to the Zika virus. Now, I don't want to compete Zika against lead. I want to compete public health against other things and get more money for public health. But the point is that we seem to be more attuned to these rapidly evolving disasters than the chronic, slow-moving disasters. Yes?
Barbara Moore, I'm the clinical director for the lead poisoning program at Mount Washington Pediatric Hospital. And since 2000, the push has definitely been required that all children have lead levels if they're in an at-risk area, which includes all Baltimore City, at age 12 months and 24 months of age. Now, if we're saying the effect is worse between that 3 to 6 year age, we don't require that another lead level is being done prior to starting, say, kindergarten or at some point. We just require that a lead level has been done and intervention has been provided. Do you think it would be beneficial that we do explore looking at getting another lead level done during that 3 to 5 age? And a lot of times resources aren't even available for children once they turn 6.
Right. So a couple thoughts. First, most children by the age of 3 have grown out of those mouthing behaviors, as you know. So the new AAP policy statement will suggest that we focus on children under 3. So I'm not suggesting we do anything different than that. What I would suggest, and which will be equally daunting, is that we first screen the environments. Right? And I know we all know that, but we continue to focus most of our efforts on screening children, identifying the children. What we really need to do is before occupancy, when you sell a house, when you rent a place, after renovation, after abatement, we have mechanisms to go in and use these baby wipes to measure whether there is lead contamination there before a child moves in. Measure the lead in water in communities where that might be an issue. And until we do that, even though we need the safety net of screening children, we will fail to protect children. We've got mechanisms. Now there are, and some of you may know more about this than I, there are mechanisms through CMS to do case management, but not prevention. So how do we get to that point? It is going to cost money. It's going to take resources. There are examples. In Rochester, they said if you want a federal subsidy to rent your place, you first have to allow our inspectors to go in and take wipe samples. Pretty cool, right? Massachusetts, many of you already know about, they put in regulations. They weren't voluntary. Voluntary, they're not regulations. Voluntary recommendations don't work. When we bought our place in Cincinnati, we really liked it. Don't ask them about the lead. You may not get the house. I mean, it just doesn't work unless you have teeth. So I think the real question is, if we want to protect kids, how do we figure out how to go into the homes before the kids live there? It's that simple and that hard.
I agree, primary prevention is the key.
Yeah, it'll be challenging. All right. Any other questions or comments? Very good.
Over here.
All right. Oh, we got somebody? Was that Pat? Hi, Pat.
So I think another big cost, of course, is education, and the children who have been lead exposed do worse in school fail to learn to read, fail to read to learn, fail to graduate from school. And so there's another whole set of costs and whole set of tragedy that we're paying for as a result of these exposures. So I think that's just another area, and you've written about that and researched that as well.
Yeah. So the annual cost, I think Leo Tresande and his colleague wrote, in the United States is about $50 billion a year in the United States. That's just for kids. It's not talking about adults, and I imagine that's going to be quite expansive too. Globally, just in the low to middle income countries, the estimated cost of low-level lead exposure, greater than 10 microgram per deciliter, that's where 90% of kids who are lead poisoned now live, is about $977 billion, almost $1 trillion. Right? So like with many other things that we restrict or ban in the United States, what happens? Cigarettes get sold to Southeast Asia and Africa and China, and that's happened with lead as well. Leaded gasoline has almost been entirely phased out. Leaded paint is still being sold quite extensively in Southeast Asia and Africa and elsewhere. So there's still a lot of global work to do. On another level, we are really at a fairly important transition point. Gasoline's been removed. That's 50% of the problem. So we're 50% of the way towards the global elimination of lead poisoning. If we can get rid of lead paint, that's another 25, 30%. Then we've got old industrial smelters and other industrial point sources like secondary battery smelters. We have old pipes. We've still got some, but if we can get those steps in place, within a generation, we could eliminate lead poisoning worldwide. It's possible.
So first,
Yes.
good to see you. I just wanted to say, from the field perspective, especially meeting you now, I think it's critical. And I want to thank you so much for this, because it's really important. And just to ask if getting banned from the CDC committee actually sent you to Canada, is that what happened? But we'd always like you back doing this work. It's really important. And you may have said this at the top, but what's your current research are you working on?
So much of what I've done has been looking at the impact of other types of toxic chemicals, from flame retardants to organophosphate pesticides, phthalates, bisphenol A. And that's mostly through a lot of younger investigators I work with. I'm trying to spend more and more of my time doing fun stuff like making videos. So there were a couple reasons I went to Canada. The 2000 election, the 2004 election. In 2005, when I went to my chairman, and I said I wanted to use some of my endowed chair to translate science to policy to protect kids. And he said, no, your job is to bring in grants. And I said, I thought our mission statement was to improve child health. And he said, well, somebody else will do that. Your job is to bring in grants. I couldn't articulate this until after I moved, but I think what was troubling me so much, I couldn't make sense of the policies or the lack of policies in the United States. But I think what's happened is we've allowed the country to be run like a corporation by the mega corporations. And I was physically ill because of it. The second thing was my dad was diagnosed with ALS. And to give you an idea of maybe this idea of cumulative impacts, and then I'll stop. Besides the 10% of ALS, it's genetic. Lead exposure is a risk factor. He had that when he was a kid working on his cars. He had head trauma when he had a motorcycle accident in Kenya. And then he had pesticide and herbicide exposure when he was a horticulturist. Now, we tend to pit one of those risk factors against another. It's lead, it's not lead, it's poverty, right? That's how we explain problems in research. But I think that simple idea is, at some point, we should stop pitting one risk factor against another and say, you know what? Maybe we should tackle them all. Maybe poverty is not good and lead is not good. But I also want to end up, since this is kind of, in some ways, a troubling talk, with something my dad taught me in the last summer of his life. And he was, by this time, completely paralyzed. And my brother and I were just belly aching about this and that, Dick Cheney and Congress and the mega corporate, I mean, everything. And we all have common views, my brother and my dad and I. So my brother and I were just going on. And finally, my dad's over here. He says, I got a lot of optimism about the United States. I said, really? He said, yes. In 100 years, I'm sure we'll be in a better place.
And how do you argue? Even though he knew he was going to die in 3 months, how can you argue? And I think what we really need to do is think about how do we change things, not tomorrow, because it ain't going to happen, you're going to burn out, but how do we change things over the next generation? How do we set goals for ourselves? If we do, I'm sure things will be better in 20 years.
All right, well, join me in thanking Dr. Lanphear.
Nice.
100th anniversary shirt for you.
Wonderful.
And to thank you for coming. So
Thank you.
we'll be here for the 200th.
All right, I'm sure. Thank you.